So good morning friends. Today we'll discuss the previous year question. This is in episode 2. Okay. So first question is necrotizing fasciitis is caused by. So the option given here are Staphylococcus aureus, beta hemolytic streptococci, Clostridium perfringens and pneumococcus. So if you come across the word necrotizing fasciitis or flesh-eating bacteria, the only term is this beta hemolytic streptococci. So that is Streptococcus pyogenes. Okay. So none of the other bacteria are called as flesh-eating bacteria or the causative agent for necrotizing fasciitis. Okay. So it is clear, I think, right? Sorry. So the answer here is beta hemolytic streptococcus. So here you won't remember these points for sure. So first it is necrotizing fasciitis or the streptococcal hemolytic gangrene. So Streptococcus pyogenes is the most common cause for necrotizing fasciitis. That is about, it accounts for about 60%. Second point, since it is rapidly spreading, so this Streptococcus pyogenes, it is called as a flesh-eating bacteria. Okay. So third point, the toxic shock syndrome. You know, right? The toxic shock syndrome is caused by, so both, what is this? Streptococcus and the Staphylococcus. But the Staphylococcus is the most common cause. The toxin responsible for this is Staphylococcus toxic shock syndrome toxin. Okay, it is called as a TSST. So, if they ask for toxic shock syndrome, the most common cause is Staphylococcus. If they ask about necrotizing fasciitis, it is in Streptococcus pyogenes. So here, so again, one of the most common cause for myositis, it is in Staphylococcus aureus. So next, these are all the previous year questions. Just I'm recalling it. Okay. Sometimes if a time is good or if we are lucky, we can get these same questions with same options too. So don't neglect the previous year questions. Second, Staphylococcus aureus causes. So option A is erythrasma, option B is cancroid, option C is acne vulgaris, and option D is bullous impetigo. As you know, it is in bullous impetigo. So some common points. So just remember there are two, that is non-bullous and the bullous impetigo. So the non-bullous impetigo, that is the impetigo contagiosum, and is characterized by honey-shaped, it is honey-colored crust. It is usually caused by Staphylococcus aureus and Streptococcus pyogenes. Okay, so whereas bullous impetigo, it is caused only by the Staphylococcus aureus. So in the above option they have given or bullous impetigo, so you can mark it as bullous impetigo. Second, so coming for the other option, the cancroid. Okay, so this cancroid is caused by, it is in Haemophilus ducreyi, and some point about is that it causes school of fish appearance, right? So the mnemonic for that is the child usually cry when they go for school. Okay, that is the school of fishy appearance. Whereas Vibrio cholerae, it is in fish in steam appearance. So just remember one thing. Okay, so ducreyi, it is in school of fish appearance. So it is an quite opposite for the other thing. Okay, is it clear? Coming for erythrasma, so it is caused by Corynebacterium minutism. So another important point for there is it usually causes in the fluorescence, it causes woodlamp fluorescence, causes a coral red color. You won't remember that point also, and it is a clue for Corynebacterium minutism. Okay. So we'll go for next question. So this is easy. And what is true about Mycoplasma? First point, it causes a lung infection. Penicillin, it is a drug of choice. Thick cell wall, and thallium acetate inhibits the growth. So if They ask Mycoplasma, you want to remember it is a primary cause for the lung infection. So, but here they didn't mention whether it is a typical or atypical. So, it's the most common cause for atypical pneumonia, and it is also called as an walking pneumonia, right? So, but in this option they have given cross-treatise and causes gross in lung infection. So, you can go to this point. So, first it causes a lung infection, and here second it's a penicillin is a drug of choice. No, it is resistant to penicillin. It has thick cell wall. No, it lacks cell wall. So coming for fourth option, thallium acetate. It is resistant to thallium acetate. That too in the concentrations of about 1:10,000. You don't want to remember the 10,000 and all. Just remember, so Mycoplasma infections are usually resistant to the thallium acetate. Okay. So remember, Mycoplasma, lung infection, no cell wall, penicillin are usually resistant. See another point you know, there is something called as a Dynes phenomenon, which is exhibited by Mycoplasma, and then it is in Friday colonies, which is called by Mycoplasma. So these are the point you want to, if they ask, if you come across a word Mycoplasma, just recall lung infection, Friday colonies, resistant to penicillin, and then it lacks a cell wall. Okay. And another point, it is an record agglutination test. Okay. There's a mnemonic also for Mycoplasma, and I have posted my shots, and I provide the link too in my description box, and kindly go through that. Okay. So for microbiology recall, it's very easy. So just you want to remember, here you want everything you want to by heart. Okay, but you want to by heart the key points over here. That is a trick for the microbiology. So if Mycoplasma, this 5 points, 1 2 3 4 5, that's all. They won't ask nothing other than this. Okay, that to this Mycoplasma is a shortest chapter, you know, right? So these are the points usually they'll be asking. Okay, next we'll go for next question. So it's a clinical question. A child came with fever, cold, and cough, and the membrane over the tonsil. So nasal swab is taken, and culture should be done. Okay, so the patient comes with the complaints of fever, cold, and cough, and there is a membrane. Okay, so if there is a membrane over the tonsil, just you want to remember the two things. One is a candida, and there is a Corynebacterium diphtheria. So how will you proceed with the diagnosis? Okay, which medium is used for earliest diagnosis? Okay, that is for the very good or the quick culture. So first, they have given Loeffler's serum slope. Second, it is in LJ media. Third, it is in McConkey agar, and fourth, it is in CET media. When you come for the diagnosis, that is the membrane over the tonsil. So you want to that too in the tonsil, it is in Corynebacterium. Okay, so if it is over the tongue, you can think of either it can be Salmonella typhi or it can be Candidiasis. But for Salmonella typhi, there will be typical history of fever. So they will be given like a child presents with a Staphylococcus type of fever or on and off fever. For Candida, the usual history will be a patient is immunocompromised. Okay, so you want to take the clue point for the diagnosis. So here it is in Loeffler's serum slope, LJ media, McConkey agar, and CET agar. So it is obviously it is in Loeffler's serum slope. So why you want to select it is, so see same point here, fever, cold, cough, it's a diagnosis of diphtheria. And for rapid growth, we'll be using a Loeffler serum where the growth will be seen within 6 to 8 hours. Okay, so that's a clue point. In Loeffler serum slope, you can see for the growth within 6 to 8 hours. Okay, so for the rapid diagnosis or for the quick diagnosis, you can go for this method. But you want to know another point, the selective medium here, it is in potassium tellurate agar for Corynebacterium diphtheriae, in which it produces a black colored colonies. So just compare. Okay, here black, so some other which produces in jet black colony, it is in Salmonella typhi on the Wilson-Blair medium. So the point, so the every point I am mentioning here is a one it's an MCQ. Okay, so I'm only mentioning the key points, so none other that the vast what is the concept, etc. So just I'm mentioning the key points in this video. So go through it the entire video. So next point. So again, I think this is a good question paper, right? So one is Mycoplasma and this is Chlamydia. They are both the twin sisters. So true about Chlamydia or all except it is an obligate intracellular organism, gram-positive, reticulate body is metabolically active and replicate by binary fission. So it is in gram-negative bacteria. Okay, so rest of all options are correct. It is an obligate intracellular organism and reticulate body is metabolically active. What is another body? It is an elementary body which is metabolically inactive and they usually replicate by binary fission. So here the organism, it is an answer is gram-positive because it is an obligate intracellular organism, but it is in gram-negative bacteria. Okay. So thank you friends.